In 2005, the State Health Department in the state of South Carolina realized that there was a very quickly growing, rapidly growing Latino population without the corresponding capacity of organizations to meet those needs. So they requested that I do some research around what were those gaps in services, what were the needs around the Latin population, in particular around maternal and child health needs, and what were some of the solutions that we could propose to address those gaps in services. So what that research showed was that one of the biggest gaps was information. Folks were wanting information about how to get the services that they needed, address their challenges, and connect to resources in a way that felt trustworthy to them, so folks that they could trust and ask the questions in order to overcome their barriers and challenges. And so out of that research, I founded an organization called PASOS, which is a community-based organization that's statewide, composed of community health workers. And so today I'm talking about the community health worker model and the PASOS organization that I ran for 14 years, and how we're helping folks address physical health and behavioral health needs at the community level in ways that feel really trustworthy to them, because it's folks from their own community that have the same strengths and challenges and cultural realities, and so they can trust them to help them understand what the next steps can be and how to do that in a culturally appropriate way. One of the successes that we had was that we realized there was a huge access issue related to the Department of Mental Health services that were offered in the communities that we serve. So we had a team of about 25 community health workers who are on-the-ground advocates that teamed up with allies from different levels, so clinics and psychologists and mental health providers, that requested a group meeting with the director of the Department of Mental Health, and to tell him that, we really needed to find a solution to folks not having access to behavioral health services. And out of that came a series of other meetings, but it led to the Department of Mental Health partnering with us to do a deeper study into what those behavioral and mental health challenges were for the Latin population across the state. And then that turned into an action plan with 5 different goals where we were able to address those gaps and challenges and really utilize the strengths of the folks that were partnering with us to address them.